Alright, so I'm going to talk to you guys a little bit about cardiogenic shock. And please be aware that my artistic abilities are nowhere near the level of Shank's, but this was more fun than making a PowerPoint presentation, so here we go. The first obvious question we need to ask ourselves is, what exactly is cardiogenic shock? Well, we learned from medical terminology that we can actually look at the word itself and break it into its parts to find its literal meaning. We can start with the prefix cardio, which we all know refers to the heart. Then we can add it to the suffix genic, which means causing, and realize that cardiogenic shock literally means the heart is causing the person's state of shock. So, essentially, cardiogenic shock is the inability of the heart to adequately pump blood to the body's cells and supply them with oxygen and nutrients. As you can see here, we have organs like the brain, intestines like we saw yesterday, a liver, and a stomach. And they're all dependent on the heart. And when it can't pump enough blood to these vital organs, they become hypoxic and start to die. When you think about it, the circulatory system is kind of like a water pump system. Our heart acts as a pump to push fluid into circulation. We have blood vessels, like these pipes here, that direct fluid through the body to our organs, which are represented by these buckets. And last but not least, we have blood that carries oxygen and nutrients through the pipes to our organs, like this water represented here. Now, if the pump breaks or has an irregular rhythm, it can't efficiently pump enough fluid to the other parts of the system that depend on it to work properly. Same goes for the heart. If it breaks, it can't efficiently pump oxygenated blood to the other body systems like the kidneys, brain, and spinal cord, which depend on it to create energy and dispose of CO2. This causes a state of hypoxia, increasing acidosis, and eventual failure of each system. Next, we can ask, why exactly does this happen? Well, cardiogenic shock can happen when there is either a mechanical or an electrical issue in the heart. The most common cause of cardiogenic shock is left-sided acute myocardial infarction or heart attack. But we also have myocardial contusions that could come from car crashes or ruptured walls and valves stemming from, gunshots, really any sort of trauma. We also have pericardial tamponade when fluid surrounds the heart, making it harder for it to pump. Then we have electrical issues like ventricular tachycardia, ventricular fibrillation, or any sort of dysrhythmia that causes the heart to pump inefficiently. Now, when one of these issues occurs in the heart, cardiac output begins to decrease, therefore decreasing the blood pressure and causing a state of hypoxia. This is when the sympathetic nervous system detects a decrease in the blood pressure and creates a compensatory stimulus that causes the kidneys to retain fluid, an increase in contractility, increase in heart rate, and vasoconstriction in the blood vessels. While excess fluid retention gives the heart a lot more fluid to work with, and the increasing contractility of the heart and increasing heart rate raise cardiac output, eventually the heart can't fill with enough blood for ejection, and arterial vasoconstriction creates a pressure that makes it harder for the heart to pump. This increase in arteriolar and venous pressure eventually causes the blood to overflow into the lungs, causing pulmonary edema, which makes the patient have severe breathing difficulty, decreasing the amount of CO2 expelled, increasing acidosis, and decreasing the amount of oxygen inhaled. Although our sympathetic nervous system is only trying to help us, in the long run, it actually pushes us into a deeper hypoxic state, causing death to the body. The last question we should ask as EMTs is, well, how can we help? There are many signs and symptoms that will point to the severity of this condition, but it's important to try and catch these issues before they become deadly. Some of these issues would include altered mental status, shortness of breath, tachycardia and angina, decrease in urine output from kidneys trying to retain the fluid, cool and diaphoretic skin, rales, a productive cough, edema, both pedal and pulmonary, increasing jugular vein distension, organ failure, and hypotension. If an EMT suspects any of these symptoms to be attributed to cardiac distress or shock, it is of utmost importance to not only treat but transport them to the hospital as quickly and safely as possible. The EMT plays an important role in the patient's survival through their quick and proper treatment of the patient's ABCs, or airway, breathing, and circulation. It's important to make sure the airway is patent, especially with mentally altered patients, and deciding whether they need an OPA or an NPA. Making sure their breathing is getting enough oxygen to the alveoli through either a non-rebreather or, if they have pulmonary edema, CPAP. And making sure their circulation is adequate through administering certain drugs like aspirin, as long as it's safe for that particular patient. Another important factor in treating patients with hypoxia is making sure that they retain their body heat. A patient with hypoxia needs all the energy they can get, especially when their organs are working so hard to keep the body alive. So it's important to maintain that energy lost from inefficient metabolism. And again, the most important thing to do for a patient in cardiogenic shock is to get them to the hospital as quickly as possible. Not only as quickly as possible, but as safely as possible. In closing, there are many terms used for the amount of time these patients need, such as the golden hour or the platinum 10 minutes. But the faster you can get this patient to the hospital in the safest way possible, the more likely their chance for survival.